مرحبا جميعا. شكرا لحضوركم اليوم لإطلاق أول نشاط للملتقى العربي.
Hello, everyone. Thank you for being here for this first session. My name is Nadim Houri. I'm the CEO of the Reform, the Arab Reform Initiative. It is a regional think tank that works for more social justice and democracy in our region. I'm very pleased that today we are launching this activity, which is part of a new consortium of research centers in the Arab region, in addition to several independent Arab media platforms. I will be speaking about them in a while, in a bit. The objective of the activity is to speak about an important topic today, which had always been also important. It is the social protection in the Arab region, especially that now the Arab region is, according to international studies, one of the regions that suffers the most from the lack of equality. And the lack of equality is exacerbated by the COVID-19 pandemic. The consortium is coordinated by the Arab Reform Initiative, but we have 4 research centers from Lebanon with researchers named the Policy Initiative from Jordan, the Phenix Center from Egypt, EIPR, the Egyptian Initiative for Personal Rights from Tunisia, the FTDES, the Tunisian Forum for Economic and Social Rights, and the independent partners we have with us, Mrs. Atalla from Egypt. I'm pleased to have her with us, our partners from Daraj, who are in Lebanon and have a regional coverage in Inkyfada from Tunisia as well. Since it's the first activity of this kind, in 1 minute, I will try to tell you what we're trying to do through this webinar and through the project as a whole. And this consortium, we're not only trying to understand what the social protection is about today and the impact of the pandemic on a wide group of different categories of our communities, but we're trying as well to widen the discussion from a specialized discussion to a community discussion, engaging several members of the community. Another important point in this activity and consortium is the focus on the mostly affected groups, the groups that got affected by the pandemic and are not always taken into consideration when public policies and social protection policies are developed. We can think of people in the agricultural sector, the impact of the COVID-19 pandemic on women, marginalized groups, refugees, IDPs, and others. Another important point, it is not only about expanding the discussion within each and every country, but we want it also to be a space for encounter and discussion within the entire region and interregionally for the exchange of experience and expertise, with the hope that this would help build an approach that we call in English a more inclusive approach. This project is funded by the IDRC, which is the International Research Center of the Canadian government. Now, allow me to give the floor to the colleague and friend Lina Atalla, who will be moderating this session of today. I'm very pleased to have you with us today, and this is going to be the first webinar of a series of webinars that will tackle several topics related to social protection in our region. Lena, the floor is yours. Thank you. Thank you, Nadim. Good morning, everyone. I'm very happy that we've launched the first webinar of this project. I'm Lina Atallah from Mada Masr, Egypt, which is one of the media partners of the research. The idea behind the webinar of today, as mentioned by Nadim, it is one of a series of webinars within this project. The idea, since the entire project addresses the social protection in the times of the COVID-19 pandemic, we'd like to try and look into the concept of social protection in the Arab region and try to go through a historic review within the nation-state concept in the region. It's a very important theoretical and historic entry point now that we look into the current times in terms of the different approaches by the regional countries as to the COVID-19 pandemic and the social protection. So it's important for us to know about our history with the social protection as Arab countries. Today, I'm very happy to have a group of experienced speakers who have a long experience and a vast experience in this field. I will try by introducing the first speaker, Dr. Adib Naama, from the non-governmental development network. Before I give the floor to Dr. Adib from the ANND, I would like to tell you that most of the interventions will be in Arabic. If you need interpretation into English, this is available. You just have to click on the interpretation icon at the bottom of the screen. If you have interventions in English, there will be interpretation into Arabic. And if you don't need interpretation at all, then do not use the interpretation icon. There is also a Q&A icon or button at the bottom of the screen if you have questions and interventions. We will have around 45 minutes for interventions, followed by a 30 minutes Q&A session. Without further ado, I start with Dr. Adib. He is a consultant in the fight against poverty. Now he's member of the ANND. He was the consultant, the regional consultant of ASQA. And he was the UN ESCWA's regional advisor on governance and state building. And he will tell us more about the macroeconomics and the political history in the region with a focus on certain aspects. The floor is yours, Dr. Adib. Thank you very much for the invitation and for giving me this opportunity. It is great for us to come together and discuss such a topic. I will try to be brief as much as possible so that we can allow enough time for discussions. I will have a simple presentation and three main ideas. As an introduction, I will share with you what the concept of social protection represents. And that is the starting point that I adopt. The social protection is a right, and for this right to be translated into actions, usually there are mechanisms, institutions, and policies or regulations in order to translate it into actions. One of the most standard forms of social protection is what the ILO adopts. And it says that when social protection regimes are developed, they must cover 9 aspects: the treatment, the sickness, the occupational safety and health, the maternity, the old age, and the survivors' allowances and pensions. That can help assess and measure the effectiveness of any social protection system or regime in the Arab region. So that is why I've mentioned such a list. Let's keep this in mind as a background, and let's move to discuss 3 main ideas. Number 1, the social protection in our region, and now in this circumstances, what does it mean? And let me start by saying that the social protection issue, especially the points that I've enumerated or anything that falls under the social protection systems, comes as a third level and assumes the presence of 2 guaranteed rights. The first one being the right to life, because we provide social protection to those who are alive. When the person is dead, then he's not anymore subject to social protection. And that is an essential point. The second right that must be guaranteed is the political, social, and cultural rights that must be respected. Therefore, this specific person or the social group is recognized as a category that is subject to protection and that must be provided with this right. What I would like to mention is that such fundamental rights that must precede the social protection system are not available, maybe partially and sometimes largely violated in the Arab region.
وبحالة الحروب هناك تهديد مباشر.
First, because of wars. In times of war, there is a direct threat to the right to life because people simply die. Therefore, the social protection system that we speak about traditionally is not included. And in the conditions of our region, that must be covered. We need to adapt and develop the social protection systems in a way that also covers the right to life amidst the conflicts and wars affecting a large number of citizens. Number 2, the social and economic rights as such. The political and civil rights as well are not guaranteed in this region. Sometimes altogether, let's speak about the IDPs and the refugees as a result of wars. So they all need a certain advanced and comprehensive type of protection that goes beyond the traditional perception of social protection networks. And like in the case of the Palestinian population that is under occupation, so all of its rights with no exception, including the right to development, are violated. Therefore, the approach must be different with this group, or as a result of the Buddhism and lack of democracy in the heretical regimes, there is no respect to the rights of people. There are detentions, no recognition of the political and cultural rights, a lot of cases of imprisonment and detentions. And this is as well very essential and not covered by the social protection systems. I am mentioning that so that no populations are told we are giving you unemployment insurance while the right to life is not guaranteed, and that is part of their rights and the protection aspect. In addition, now amidst the COVID-19 pandemic, we are also in need of a certain type of protection that is holistic, comprehensive, and compound, not partial. It is not a health protection because we perfectly know that the COVID-19 pandemic, even if it's initially a disease, it has political, social, cultural, psychological repercussions. Therefore, we are in need of something that goes beyond the traditional approach of social protection. That is idea number 1. Number 2, let me speak about 2 different approaches or largely contradictory approaches as to the social protection. The first approach, which is very common, we come up with social assistance, social safety nets. But the main idea here is based on what is existing in the social and economic structure. This is good, it works well, but there are certain distortions in the market and in the mechanism, and such distortions result in poverty and some people in difficult situations, and they need the social assistance or social safety nets. They are targeted with special policies and procedures. That is the first approach. Now, this approach, which is very pervasive, very common, we have the traditional social assistance to widows, orphans, children, etc. Or we have the so-called social safety nets, networks of the modern world. They're very developed, and they're presented as the best solution to poverty, cash transfers through the safety networks that the World Bank in particular calls for. Those interventions like to fix poverty through poor people exclusive interventions without any changes to the general policies, and usually in a way that is isolated or partially isolated from the public policies, without any amendments, modifications, or structural reforms to the economy and the policies. And there is another approach, a right-based approach, and the UN agencies usually adopt such policies. The CSOs and a lot of independent researchers say that we cannot limit ourselves to the social assistance systems, because the right to social protection is one of the human rights, and it's a right for everyone, right to all, with no exceptions. It is not exclusively to the poor. It must involve everyone, even if we need special poor policies, but there must be no poverty fighting policies that are totally isolated from the comprehensive development policies, because it's not possible to eradicate the poverty if we only limit ourselves to the poor, because the reason behind the poverty is not the poor. The poverty results from the economic and social system. So such an approach to social protection involves the fact that the social protection must be comprehensive, and that is the opposite to the targeted approach. It must be comprehensive, based on rights. It is right-based, and it is not based on assistance, compassion, or courtesy. It must be part of a comprehensive social development strategy and anti-poverty strategy that is funded and structured through independent mechanisms by the state, so that it can ensure sustainability. And that is opposite to the first approach that I mentioned. Let me present three main points here. Now, a discussion around social protection in Lebanon, and there is the World Bank $246 million World Bank project. And the issue with this project is that first we need to borrow $246 million to make it happen, while we are in an indebted country and we stop paying debts. And number two, it's a procedure and action that is isolated from other policies, knowing that in Lebanon now there is a comprehensive social protection strategy that is being developed. Nevertheless, this project is presented on its own, and it's in contradiction with other suggestions that are totally unstructured. The other issue is that this project will be partial, while 60% of the Lebanese households are in need of assistance because of the financial and economic crisis, in addition to the COVID-19 crisis, because we have a more serious crisis other than the health crisis. We have 60%. They will only cover the 20%, and those above 20%, the 21% will get nothing, and that's a big problem. And then with regard to what we know, the way it will be implemented and the way we see in all of the discussions, this is going to be a mechanism handled by the people in power in order to fund their own electoral campaigns if elections are organized, or as a political funding, because the distribution is going to happen practically through institutions and administrations that are held by the political parties in power. Now, I mentioned this because while this project is being devised, for example, the budget presented by the Lebanese government to the parliament, the budget of 2021, includes a clause that provides for the following: all civil servants from the public sector who joins the sector now or in the future are not subject to the pension scheme. The public sector used to benefit from the end of service only, while other sectors have nothing or get an end of service compensation, while now the pension, old age allowances are removed for those who join the sector from now on, while the social demands in Lebanon and even the recommendations are to enlarge and widen the pension scheme to have an old age scheme. They're doing the opposite, and that shows the contradictions between the isolated targeting approach and the real policies that are adopted. Number two, in quick and brief, sometimes the social protection coverage is widened, and there are certain examples. In Egypt, there was a gradual expansion of the social protection. I will give you the example of the health coverage in 1998. It was 10%, and it is now 58 in 2015. It was 58%, and it is a big progress. It looks like there is progress. But in 1990, the out-of-pocket payment on health was 56% of health expenditure, while the coverage was 10%. When the coverage became 58%, the out-of-pocket individual health expenses became 62%. So we give more, while in reality, it is less. Same in Palestine between 2005 and 2016, with the increasing coverage. We went from 34 to 45%. Same thing in Morocco and Jordan. What is the idea? The idea is when the state says, I widened the coverage and I included other categories, that is not enough as an indicator as to reaching the needed objective, because that doesn't mean that the expenses, individual expenses reduced, but what the studies show is that the expenses are increasing. So such an indicator is not enough to say that the situation got better. One last idea: when we are in a crisis situation, we hear a lot of interventions, instant interventions. We don't have time to plan for the future. So humanitarian intervention comes before the development intervention, and that is wrong thinking, because the urgent and quick intervention now might lead to the adoption of harmful policies, such as the example that I've given you now about Lebanon. We distribute money, we distribute cash instead of fixing the problem. That is not okay. There must be always linkages between the humanitarian interventions and the development interventions. Thank you very much. Dr. Adib, thank you very much for your intervention and for the important questions and ideas that you've presented. Very good insights. I'd like to tell the attendees if they have any questions to share with us. Now we move to the intervention by Dr. Rana Jawad. She joined the Department of Social and Policy Sciences at Bath University in the UK in 2009. She's currently the Director of Studies for the first-year program in Sociology, Social Sciences, and Social Policy. And she founded in 2013 the MENA Social Policy Network and the MENA Social Policy blog for the MENA region, Middle East and North Africa. Dr. Rana will speak about the nature of the social protection systems in the Arab region and the role of local, regional, and international institutions, including the IFSCs or the international financial institutions. Dr. Rana will speak in English. So those of you who'd like to listen to Arabic, you use the interpretation icon at the bottom of the screen. Thank you very much.
يعطيكم العافية جميعا. أنا بحكي عربي بس
Thank you very much. I do speak Arabic, but I'm sorry, I work in English, and in order to share the ideas in an appropriate way and without being very slow, I will speak in English. Thank you for the invitation. I'm pleased to be with you and to get to know this project launched by Ari. I'm just sharing my screen now, and I hope that you can all see my screen. Okay.
Okay, so I'm going to switch into English, and thank you very much to everybody. I think there are some English speakers in the audience, so perhaps I'm balancing Dr. Adib's very interesting presentation by speaking in English. And thank you again. It's an honor to be part of this meeting and collaborating with you on this very important topic. So just as an overview, I'm following the instructions I was sent in terms of what to present, and I'm doing this backwards. So I'll begin with the current context of some key social spending indicators. Sorry, there's a misspelling there. This should be social spending rather than social sending, and looking at some key indicators of the Arab region, and where possible, trying to identify relevant information for the countries that are of interest: Lebanon, Jordan, Egypt, and Tunisia. And within the sort of the tight time that we've got, I'll refer to some common or distinguishing social policy features of the institutional and structural makeup of these countries. And then I will end with just a reference to the international arena and the extent to which it's influencing the development of social policy and social protection throughout the Arab countries. So just to begin with, I feel it's important that we clarify a little bit some of the terms, and that I clarify where I stand on some of these debates. I work on social policies, and my interest therefore is as much in the delivery of services to vulnerable groups and excluded groups as it is in what we often refer to as the larger political settlement that underpins social rights of citizens and residents and their access to public services. And I would invite colleagues, I would love to hear your views on these things, but I think that it's important to help to clarify these distinctions in terms of where social policy sits and where social protection sits. So in some respects, social protection is a much narrower field that specifically targets poor and vulnerable populations and is particularly concerned with income maintenance. And I'm using here a definition that's commonly used in the literature. And so in this sense, I would say that social protection feeds into a wider social policy system and a national vision of social policy. And of course, taken together, the national actors, local actors, international actors, of course, all of them together form the social policy landscape of any country. So of course, the Arab countries that we are referring to would fit within this context. I'll begin to turn now to the Arab region. There's a phrase here that many may be familiar with from, I think this was the very first Arab Human Development Report, another spelling error, I do apologize, Arab Human Development Report in 2009 that described the Arab region as being richer than it is developed. In some ways, a lot of us may lament this, that there is a sense of a missed opportunity and a sense in which things could be different. And I think I would hope that there is some hope remaining, and that we're not completely pessimistic about the prospects of social change in the Arab region. And I think that the event today and the continued efforts of all of us working over the years, hopefully can lead to positive change that we will see in our lifetimes. But there's very much the sense in which things need not be as they are. And I think some of the political economic background as well that we are aware of this region would suggest this. So with this in mind, I'm just going to run through sort of just the general situation of where we are currently with the Arab region. And in some respects, we can argue that not much has changed over the last few decades. I'm sure a lot of colleagues are well familiar with this data, perhaps more than I am. And it's helpful just to review some of the current context of the countries. When it comes to poverty, we tend to rely on the global statistics, which we will refer to at the end, because they are comparative and they can give us a sense of where this region sits in relation to global averages and the rest of the world. And of course, there's lots of debate about the accuracy of World Bank statistics that I'm presenting here, with all due respect, if there's any World Bank colleagues on the call, and the extent to which they underestimate levels of poverty, and as I will show in the next slide, levels of inequality. But overall, where we have data here, we only have for Egypt and Tunisia, as I'm showing to you. And Egypt would be one of the countries that would probably be the third highest in terms of level of poverty, according to the $1.90 rate of the World Bank. In terms of inequality, there's increasing talk about inequality. Again, there's a gap in data, and again, we rely on the Gini coefficient. And again, debates about the extent to which these underestimate levels of inequality in the region. And there is the mainstream discourse would argue that Arab countries, including the ones we're interested in this project with ARI, tend to have moderate levels of inequality, or indeed low levels of poverty. Yeah? And that was why the World Bank described the inequality puzzle of the Arab Spring. And so again, we see the countries that are of interest to us, Tunisia, Egypt, Lebanon, Jordan, as being roughly along the sort of same levels, and being, again, showing fairly moderate levels of inequality according to the Gini coefficient. But as I mentioned earlier, the region is known for the phenomenon of jobless growth for the last few decades, and hence the high levels of unemployment that I think a lot of colleagues are already familiar with. And as Mr. Adib referenced at the beginning, and I think a lot of us already know this, there is already reference to the MENA region having the highest levels of inequality. A recent study by Alvarado showing that the share of income accruing to the top 10% and 1% of the population exceeds 60% and 25% of total regional income in 2016, respectively. So we are looking at a region of rising levels of inequality. And again, the big issue of unemployment that we are all well familiar with, and we can see here that the countries that are of interest for this project, so Tunisia, and Jordan, Egypt, Lebanon, there is data for them. There's often data on unemployment. This is, of course, formal employment, because we know that there's a very high rate of informality in this region. And again, a very big gap in terms of how social policy and social protection services address the needs of informal sector workers, and indeed whether informal workers want to be included in a social protection system, because there is emerging data now that shows that a lot of workers in the informal sector are choosing this for a range of reasons, and one of them is because of the lack of the interest in being part of formal taxation systems or formal insurance, social insurance payments. And we can see here that Tunisia particularly stands out across in terms of the 4 countries looked at in this project in terms of levels of unemployment. And this is well documented in the literature. Female employment, lest we forget, has been noted as being the highest in this region, in the Arab region, in comparison to the rest of the world. Here there is a comparison across the 4 sub-regions, within the Arab country context, and we see that there's no particular reference to our countries, but certainly across the Maghreb and Mashriq, the rates of female unemployment are just a little bit below the average. Female employment, rather, are just below the regional average. So again, we have not a very effective record for female employment across the countries that we are looking at. And of course, women and youth form very much the core of the informal sector within this region. And as you can see here, the slides on youth unemployment, again, a very big issue for the countries that we are looking at. And again, Tunisia and Egypt in particular stand out as suffering from this particular issue. I move on now to social spending data. It's quite fortunate that in the last few years, this data has become available or more available now for the Arab countries. And again, it is collected by the international development organizations and harmonized for us to be able to compare them. So a lot of this data is still in its infancy, and there is across the different donor agencies disparities, some disparities in how they are measured. Officially, and this is, I've tried to use the data from a forthcoming UNESCO report, so I need to thank the colleagues there who have been working with them on a forthcoming report in relation to social protection. The global average, the average overall globally is over 10% for social spending, and I will show this to you in a later graphs. And a lot of the countries that we are interested in, and again here you've got more than the countries we're asking for, are generally well below the averages globally. But as you can see, some of them are particularly low, such as for Lebanon, perhaps for obvious reasons there, with some of the higher rates, as you can see, the gray line for Egypt just here, and the yellow line for Jordan. And then Tunisia has been fairly constant with the dark blue line somewhere there. But all of these rates have been dipping. I appreciate this is not very up to date in terms of the information that we have, but we've been trying to compare countries so that we get a sense of the historical trends of social spending. And this data particularly includes, does not include health expenditure. But as you can see, and so this is using another source of data, which is the this is the ILO as well data as well is included here. The global averages on spending are substantially higher. And I thought it would be interesting for you to see this comparison. It only has Tunisia here, I'm afraid, but the average for the Arab states in terms of public social expenditure, including health, is the lowest in the world. And you can compare this to other world regions. And I think that if we're going to start somewhere in terms of understanding the trends and the importance attributed to social policy and social protection, specifically in the Arab region, it's important to have a sense of where this region sits globally. In terms of breaking down some of the spending, there is an interesting view here on social assistance, and I will come back to social assistance because there is a very heavy emphasis on social assistance spending in the Arab countries, and a philosophy of charitable targeted social assistance if someone is not included in the formal employment-based social insurance system. And I will come back to these features when we get to more qualitative slides on the countries themselves. But as you can see here, again, for Tunisia and Egypt and Lebanon, there is always a presence for food and in-kind subsidies, particularly in the context of Egypt. There is also a heavy emphasis on conditional cash transfers, and in the case of Tunisia, unconditional cash transfers. And of course, in Egypt, there's been a lot more progress in terms of the Takaful and Karama program, as highlighted by the previous speaker as well. But again, just a sense in terms of the kinds of emphasis that these programs have. Subsidies, as far as I understand, are not included in this particular data set. So I did want to show you, this is the last slide, I'm pretty sure. So if we're talking historically, this is some internal data that had been prepared by World Bank analysts, dating back, as you can see, to the 1990s. And I think it's quite important if we're thinking about social policy as being not just about the delivery of services, but also about the institutional underpinnings of a society where people are protected as their income is lost, or as they encounter crises or changes or contingencies in their lives. Then we're looking at the MENA region here. The MENA region stands out as being the highest spender on social assistance, and one of the lowest, if not having a lower share of social insurance spending. So there is a heavy reliance on a means testing, targeted approach to spending. But here in this data, subsidies, as far as I understand, are also included. And this was part of the argument provided by the international development institutions for the need to cut the social assistance budget in the Arab countries more generally, because it was seen as artificially inflating the social assistance budget. But you can see historically that this is a region that has relied on this kind of understanding of social policy as targeted and focused on vulnerable groups. So going backwards then in time, we see again remnants of this in the reactions in the aftermath of the Arab Spring, and this logic of more social safety nets. So again, as Mr. Adib was saying before, the idea that, okay, we'll give you a bit more cash, we will expand the base of people that we're helping. But is this permanent help? Is this kind of assistance at an adequate level of benefit that can actually allow people to meet the costs of living? So these are all questions that continue to prevail for this region. And certainly after the Arab Spring, we saw more of this knee-jerk reactive approach to alleviating political and civic unrest. So more subsidies, more in-cash social assistance. I've only just named a few here, and all of you will probably know these better, having lived through these events yourselves. But this logic of, let's just give a bit more cash, let's just help a bit more of the poorest, is very much, sadly, what's characterized social policy thinking in a lot of our countries, only in the last 3 to 4 decades, I should say. Yes, so I think as we begin to kind of go back in time, I think it's really important to remember, and perhaps the older and more experienced generation in this meeting will know that certainly after the post-colonial, in the post-colonial era and the post-mandate era, the era of nation building in the 40s and 50s, and a lot of these countries saw a peak in economic growth, government agencies and government institutions that were very keen to provide and share wealth and share the benefits of their societies, very active civil rights and workers' rights and women's rights movements. And of course, in some respects, a lot of these countries experienced their glory years in those sort of those couple of decades after independence. But soon, for a range of political and economic factors, and not least because of the type of political structures that were in place in the colonial following decolonization, the social contract, if you like, and there is a lot of talk about social contracts at the moment, has became what some analysts describe as the autocratic bargain, especially where public sector workers were involved. Many governments, and including our countries in this, referred to in this project, would use welfare benefits or social insurance benefits for political allegiance. And from around, and of course, the oil price, yeah, we don't mention the background of oil, of the oil economy and how it influences the regional political economy of these countries. So from the 70s onwards, we can talk about an autocratic bargain that has increasingly come to define the system of social policy in our countries. So we have a situation where we don't have a clear vision for social cohesion and for how society comes together and for how society looks after each other within our countries. I appreciate I might be generalizing. All countries have conflict or some kind of difference of opinion, but it's how these are resolved and what vision the overall nationally is there. And I think what often struck me when doing research in a lot of these countries is starting simply with the names of ministries. So we have in Lebanon a very sort of ambiguous general name for the Ministry of Social Affairs, which, you know, you kind of really wonder, so anything and everything can be social affairs. But a lot of ministries will be called social assistance or social solidarity. And of course, we have social development. And these are largely the ministries that will be focused on vulnerable groups and targeting social assistance to these groups. In terms of, therefore, the categorization institutionally of how social policy works in our countries that we are referring to, and again, this has been referred to earlier, we're looking primarily at 3 pillars, if you like. So an employment-based social insurance system. If you are lucky to be in the formal sector, you will largely get those benefits for yourself and your family. Unless, you know, maternity benefits is another question, but, you know, generally that's the picture with a male breadwinner approach to social policy. Then we have a system of both state and non-state targeted and means-tested social assistance. So cash transfers, food support, all kinds of allowances, and in-kind ones as well. And then we have this reliance on universal food and fuel subsidies, which of course is heavily being challenged now, and, you know, with various experiences in that regard. Historically, there is a reference to an urban bias and a regional imbalance, with agricultural workers in particular being excluded. And I appreciate that our next speaker will look at questions, will look at the agricultural sector, but it is well documented that there is this urban bias. And yeah, I've got 2 minutes. I've just seen it. I'm nearly done. And because of bureaucratic issues, a fair amount of duplication, wastage that's referred to across the countries. Some distinguishing features, we could say that Lebanon has an over-reliance on the charitable and religious sector, who are affiliated to different sects. And of course, conflict is a situation that perhaps affects this country more than the others. Internally. Jordan has a smaller number of independent civil society organizations, perhaps, as we all know, more patronage by the royal family, and of course, like Lebanon, dealing with the refugee population. Egypt and Tunisia perhaps have had a more centralized system of targeted social assistance, although definitely Egypt, I think, has been undergoing some major reforms. And of course, we know in Tunisia, the very high rates of unemployment and informality there, and the relatively stronger role for the trade union. But overall, these are countries that share very similar characteristics. So this is my last slide. Going back then to globally, I hope it's fairly clear to you that the data that I've shown you is by global organizations, and I've referred to that post-colonial past that the Arab countries the Arab countries share with the sub-Saharan African continent, with Latin America. So this is not an exceptional region in that respect. A lot of the issues are shared globally, but I would characterize social policy development in this region, and others have done this, as being reactive and crisis management, and led by the donor funding and led by the international discourse. This doesn't cancel the long-standing employment-based social insurance systems that have existed in this region. It also doesn't cancel the very vibrant civil society sphere that all of these countries have. And I think it's very easy to sort of say it's all doom and gloom. I do think that as long as we are one example of perhaps some kind of counter narrative, if you like, and without exaggerating that, but certainly there is this crisis management approach, which for good and bad reasons may be the result of war, may be the result of a not fully well developed vision of social policy. An emphasis on targeted social assistance, as I mentioned, as Arab Barometer surveys have shown, sadly low trust in government and high aspirations to migrate. And we continue to have excluded populations amongst the self-employed, agricultural workers, people with disabilities. Yeah, we very rarely speak about people with mental or physical health disabilities in this region. And finally, I would end that the civil society and religious welfare groups historically perhaps had more of a public role, but I think increasingly have supported much more of a means-tested approach to social assistance, focusing on vulnerable groups and sort of leaving still this gap in terms of national cohesion and a more cohesive view of social policy. So thank you very much. And sorry if I took too long. And please do join us in the MENASP network if you can, or follow us in the future. Thank you again.
شكرا يا رنا وشكرا على كرم التقديم والمعلومات
Thank you, Rana. Thank you for such an enriching presentation. Thank you for the thorough insights. I'm pretty much sure that we'll get back to you as to the centralized social policy data and related topics. Let's now move to the third speaker, because we're running late. We have with us now Dr. Mohammed Goueli, professor in sociology at the University of Tunis and the former general director of the National Youth Observatory in Tunisia. He's an expert in social policy. Dr. Mohammed will speak about the inception, the concepts of the social protection in the Arab regions, the agricultural and rural settings, in particular, more vulnerable groups, and particularly the floor is yours, Dr. Mohammed. Thank you very much. I'd like to thank you for this invitation. I'd like to thank all of the colleagues. First, I'd like to explain that my intervention will be very brief. It will present questions rather than answers. I'd like first to thank Dr. Adim Naama, Dr. Rana Jawad for the clarifications and the enriching insights. In the same direction, I'd like to speak about the idea of the social protection with a focus on the Tunisian case and the main questions that face the social protection and the social protection systems based on a sociological background, because a lot of transformations happened, and it's not possible to think of social protection and the social protection systems the way we used to do in the 19th and the 20th century with the new social protection systems and with the requirements as well as the crisis, in particular in Tunisia, and what are the requirements of a new social protection system. Those are the questions that I'll try to present. I'll not give you answers, but probably some ways of thinking and reflection, which is more important than answers. In Tunisia, for instance, the COVID-19 pandemic had disclosed the social protection system. At least it had placed that in a critical position as to the relation of the state with the social protection system and its capacity. In Tunisia, we had a big experience that dates back to the end of the 19th century, and I will speak about it very quickly. The COVID-19 pandemic had really unveiled the social protection system and its institutions. The emerging changes didn't allow to take into consideration the social situations. Now there are new questions and new situations. What does it mean, for example, to include the rights of the minorities, the rights of the ethnic and gender minorities, the cultural rights into the wide social protection system? I think this is an important question. Number two, we're not anymore like in the 20th century where we used to think about an integrated society. Now it is rather a different idea. It is something that leads us to several risks. Now we live in the so-called Société des Individus, or the society of individuals. An individuals-based society, it is not based on the classical sociology concept of an integrated society, whereas there is social cohesion, and that's through the different institutions and the social protection institutions. So there are big question marks as to how the individuals-based society can be. It's a society that interacts, but at the same time, the individuals in the society are the cornerstones. They have their own individual projects. So individualism in the society is now increasing in strengths, in positivities, negativities, questions, and different contradictions. So now we are in front of social protection systems that are confronted by individuals facing a society of individuals, where individuals would like for the social protection system to be personalized somehow, and not a cash assistance and health assistance based system, but based on the new needs of the individuals. I mean, the self-esteem, the self-esteem, whereas the self, the ego, is at the center, is at the core focus. So all of these are elements that are very important and that show tremendous social changes and transformations. At the same time, we cannot come up with a new social protection system without considering and accounting for such transformations. This is a very important question, I think. Even unemployment, and Dr. Rana spoke about different cases of unemployment rates going up in Tunisia, and that is very correct. Statistics do show that. However, with an unemployment phenomenon, because the unemployment had been here in the 60s and the 70s and now. So it's not only about percentages and an increasing unemployment rate, but the perception is also important. How is it perceived? Do people perceive their unemployment the way that it used to be perceived in the 70s? I don't think so. So the current generation In February 2021, those who are unemployed with high degrees do not perceive the unemployment the same way the youth used to perceive it in the 70s and the 80s, regardless of the rates. The perceptions change. Why is that? In the past, in the 70s and the 80s, the unemployment was a social problem, i.e., it used to be lived and represented and perceived as a social problem. Therefore, there must be collective solutions. So the state is responsible, is in charge of, as a welfare state, in charge of finding solutions to the unemployment. While now the unemployment is not experienced and is not perceived the same way. Now it is considered as a personal failure case, and that is a big change. So the person would now think that he was in front of opportunities that he or she didn't seize. He lives in a way whereas he feels like he's responsible for his unemployment. Of course, he holds the state accountable as well, and he or she considers that the state has nothing more to give in this field, and that's part of the social protection system, and therefore he or she must find his or her own salvation, an individual salvation. It is because he or she had experienced the unemployment as a personal failure, and that leads into the migration, looking for job opportunities elsewhere. That gives the justification to this, and most of those who hold high degrees now do not accept any job. Why not? Because any job, whatever it is, even if it's a temporary job, would affect their ego, their narcissism. Therefore, they rather remain jobless and not work temporarily, even as to provide as a living. So it's a big problem. Now the unemployment is not anymore a problem that affects the society in the rural and urban areas. So from being a collective problem, it turned into a personal failure where you must seek personal salvation. So this set of questions are important to consider, and that takes us away from the idea of social protection institutions with funds and activities. They do not match. I think we cannot think this way anymore. Such sociological questions are important. I believe that we need to take into consideration the transformations that I have highlighted. A question: the rights of the LGBT minorities in Tunisia, and now this is being discussed. Can they be incorporated and can they be covered by the social protection system? By social protection, we mean the protection of the intellect, the sexual orientations, the individual freedoms. Can we make it part of the social protection system, or do we maintain the idea of the social protection and the paradigm of the 21st century, the idea of the social protection that is within the social and economic rights? This is an important question, and that now makes the social protection system perceived in a different way. I'll give you an example about it. In the project that you speak about, can the LGBT or other minorities be part of the project and consider that the rights of the minorities are part of the social protection system in the Arab world? This is very important. It's an important question, of course, along with the economic, educational, political, and other rights. All of that is noted, but I think that these questions must be raised and given importance and care. In Tunisia, the social protection system is old. Since 1998, under the colonial concept. Back then, the social protection system started to become operational with the French and the foreigners. With the 20th century, we started having it discussed amongst the indigenous populations. But to speak about the state nation that benefited from the French paradigm, the social protection system was vast and very important. It used to include pretty much all people, all active workforce in both the public and private sectors, and all what relates to the deprived families, households, accommodation, health programs, a full-fledged system that was operational and gave a lot of rights. And in Tunisia, there are two institutions, one for the private sector, for the national fund, whereas public workers benefit from for pension purposes. And there is another one, another administration or institution of a state institution that also cares for the workers in the public sector. By the early 19th century, it was considered one of the strongest, but now it is in a total collapse situation. Those two institutions rely on funds by the state in order to support all of the retired. It's a big problem. It's a governance issue, of course, because the idea of social protection in our region and even in Tunisia was used for social peace. Of course, there is a political background and a political use, and an organization, a civil society organization that is under the sponsorship of the state, the Tunisian Federation of Social Protection, social assurance still exists with a lot of controversial aspects. So there was a kind of arbitration aspect handled in the case of social problems. So it's a type of political censorship to ensure social peace with a big unionism support. But towards the end of the 80s, with the structural adjustments, the situation
تضبط ولت الدولة التونسية تمشي بشكل واضح إلى التقليص من هذه الخدمات.
The state started to reduce such services. Now the institutional level got very weak. So here I've presented to you a series of questions, and I'd like to conclude. This is project relevant to the project. I think that a project without a clear strategy would make it like any other project. It would get certain funds, conduct certain activities, and that would be the end of it. But such an important project should not be limited to such a circle. We need to think more about any new social protection system amidst the big transformations in the region. I think this must take us away from the social protection crisis in the Arab region in general, and taking into consideration the peculiarities of each and every country, and that would help us think more carefully about it. We need further thinking. Thank you very much for the attention, and sorry for taking too long. Thank you very much, Dr. Muhammad. I think that the historic background, the concepts, and the approaches presented help us have a critical perception for a realistic research endeavor in a way that really meets the realities. I will start with a general question to the three speakers, and I'm thinking about the attendees. You can join us through the Q&A or the direct chat. First comment to Dr. Adib, Dr. Muhammad, and Dr. Rana. Based on these three interventions, something related to what you raised, Rana, in your presentation about the colonial legacy and the formation of the social protection concept, and in the formation of the national state, the social contract, and the evolution of this concept with time as a bargaining tool amidst politically conservative regimes with different levels of conservatism. The question is, do you think, based on your experience, this bargaining is sustained? Can we still speak with this rationale, or do we speak rather about a total change in the role of the state in general? That is number one. Number two, connected to what Dr. Adib mentioned regarding the social protection and the rights. Are we in a point where we can say that this relation is conclusive in the current circumstances where we operate and where we get affected? So together with those two theoretical questions, I'd like to get back to the questions of Dr. Muhammad in the last presentation about the new requirements, the idea of the social transformations, the society of individuals. How can that really let us reconsider what we know about the social protection? Can we, for example, here speak differently about the role of the different individuals? For example, the civil society organizations, development organizations, charities. Can we speak about different dynamics to understand the different roles and the different perceptions as to the role of the state and the positions of the state with time? I'd like to start with this idea. The linkages between the different interventions before we move to the questions from the chat. Who'd like to start? Dr. Adib, if you want to start, go ahead, please. I will try to interact with your questions. And there is another question that I've seen in the Q&A box. big changes occurred as to the situation of the state. And now let me use terms that have been raised during the COVID-19 pandemic. It's not first a failure of the social protection system, it's a failure of the currently used civilizational system, which had structural problems for decades, but now had been clearly seen with the neoliberal situation, which has caused this crisis and which now suffers to get out of it. So the COVID-19 again raises existential questions. The answers, of course, it didn't cause that, but it unveiled the situation. But what it unveils is that the economists will not come up with a solution, because in the past, we've always used to think that the economists will get us a solution. Before that, they used to think that development activists can come up with solutions. After the independence, it was thought that engineers or right activists can come up with solutions. So 100 years ago, there were changes. Every now and then they think it is about attorneys or it's about engineers. For a while they used to think engineers. Lately economists can give us a solution. The answer will not come from here. It must come from the encyclopedia scholars, let's say. So it is a historic, social, philosophical thinking. I do not mean individuals, but the way of thinking can get us into solutions to the crisis that we suffer from. And that takes us to a whole different level. What is the reality? What can we do? What is the reality now? Can we imagine now in the 21st century, in 2021, that we might have a past like in the past? It did happen. One of the reasons of the crisis and the failure in developed countries in Europe and in the US is that they thought that they're beyond the pest and the plague. There are no more epidemics. They think about non-infectious diseases now. They thought that they're beyond that. That is why they suffered from failure. And the same now happened with the ecologists. And 20 years ago, since 1987, they started speaking about problems of the climate change and the environment. They don't answer them. And some even still think that it is a conspiracy. It's a communist conspiracy, and they do not respond to that. So there is a big failure from a philosophical understanding. Now there is an acute conflict in the civilizational pattern, where, for example, you have the exchange over the consumption versus the opposite. So we either use the benefit-based understanding, or we go to something where you have interests mixed with ethics, etc. And I think that COVID-19 takes us here. That is why I think that this goes really beyond what we are witnessing. Of course, we need new patterns. We need to go into more rights. The failure is due to the regression as to rights, and it had led us into a nightmare. Take the example of the US with Trump. beyond the rights, the interests, the state regression led into this situation where, for example, they're getting into the third world state interventions. Our problem in our countries, the countries where we live, are countries that, and I think that there was a Inkyfada, who's the sociologist, is genius, and he called it the patrimonial state. There is a patrimonial state and the modern state, and the patrimonial is old. We are a neo-patrimonial state. I think our states are neo-patrimonial states, and I've translated into Arabic in my book of 2014. The direct translation is غنائمية. The idea of the state as a bureaucratic institution that is neutral with compromises is over. It was there at a certain time. The idea of the social contract is not anymore established. It is not a social contract where they give security versus food. And we are in an extreme situation. The international environment encourages that. It doesn't go against it. The only alternative is to go towards a right-based situation. Yesterday, the Security Council was discussing what to do with COVID-19. What do you want clearer than a plague where they disagree about intellectual property rights, how to fund the vaccine companies? The Security Council mentioned an international initiative yesterday. There is no way out unless we move to a right-based system in everything, and social, in the social and economic aspects, and go beyond this narrow and ineffective idea of seeing the poor. I measure the poor and I give him assistance in a targeted one.
شكرا دكتور أديب. دي فرصة برضو ان احنا نعلن على انه الويبينار القادم في الحقيقة هو عن سياسة انتاج اللقاحات وتوزيعها من منظور اقتصادي عالمي ومن منظور سياسي مفاوضاتي من
Yes, from a political perspective, from our states, this is something that will be discussed later on. Dr. Rana, if you want to comment on the questions from my side about the support, the conditional assistance, unconditional. Do you have something to say about the conditional and unconditional assistance from a right-based approach?
شكرا لينا. اوكي، انا حجاوب بالعربي لانه اهين هيك نحكي بالعربي. فلينا سالتي سؤال اول شيء عن تأثير النظام.
First, you asked about the impact of the colonial system. And according to what I know, researchers across the globe still speak about it. And there are institutions that they've inherited, and there are political systems and social protection systems that we inherited. So the roots are still there. But I think, and Dr. Adib highlighted that the Arab governments, like any other government, still take decisions, but their positions in an international capital system, they take decisions that help them be part of this international economic system. And the proof is that the inequality is increasing. There is progress, but it is not well shared. So governments are responsible. There is agency in this. The decisions are taken.
بكل العالم وموجودة وعم بيحسوها هلا بالبلدان المتطورة وبريطانيا ضمنهم وهي الفكرة.
In developed countries, they feel that, and the UK is part of it. Unregulated capitalism. There are different types of capitalism, but we are in a situation that is purely neoliberal, and the focus in developed countries, there is a feeling or a sense of concentration of wealth with big companies like Amazon, Google, whereas the state supports the big businesses and the businessman. That is what is happening. So all populations feel and sense such inequality. I'm not saying that it is all due to colonialism or inherited by because of colonialism. As a researcher, I've been working on the region for many years. There are a lot of activists outside the state. There is a high level of education, but unfortunately as well a high level of migration. But within our scope and international institutions are important. The SDGs, the Sustainable Development Goals, change the work and helped us speak more about the social protection and the social policy. So we do not lose hope with the activities that we conduct. There might be change. And I think that the analysis capacity must be there. Researchers do exist, and I think that the work must be done from within the states. And when decisions are taken at the level of the governments, they must also benefit from the skills and competences that they have in the country. That's what I'd like to say as a researcher. Now, regarding the conditional and unconditional cash transfers, I didn't speak and work on it in details, but there are a lot of studies. The unconditional transfer is where there is a condition to send for example, kid to school, or let the kid have a medical test. They get assistance from Latin America and elsewhere. The cash transfers also led to conflicts, and there is the problem of the exclusion error, a high exclusion error, especially now with the austerity and the digitized mechanisms, the use of algorithms. So we consider that the algorithm helps get rid of people who do not deserve, while the people who must benefit do not have access because of the data collection. But I think that the unconditional cash transfer is something that they focus on in the Arab countries. Thank you very much, Dr. Rana. Dr. Muhammad, in addition to our questions, there are two questions based on your intervention. Where can the individuals start, from where can they start to work as individuals, not only as governments? That's based on your idea about the society of individuals. Another intervention about the unemployment, the differences now. How can we understand this perception, different perception to unemployment in a deeper way in order to come up with correct procedures and take meaningful decisions? Dr. Muhammad, you are muted. Turn on the microphone, please. Yes, thank you. Good. My concern is that the social protection system in general cannot be looked at according to the old decades understanding. We need to take into consideration the new requirements and the new changes. This is very important. So individuals are not the one who lead the social protection system. That's not what I mean. What I mean is that individuals are at the center of the social protection system. Their individualism, not as individuals, but their individualism is at the core heart of the social protection system. What I mean by individualism is their new requirements, their ideas, their trends, their self-perception, their capacity to move around. So the social protection system is not based on the individual, but on the individual as a subject. So it is based on the person as a subject, as an individual, and this is a problem. This is a big problem, in my opinion, and we need to take that into consideration. And that had made the different social protection institutions, the school, the hospital, the transportation, all institutions that can be included in the social protection system are in big crisis now. So there is the so-called collapse of institutions in Tunisia, especially in the last 10 years. Unfortunately, as we say, there are big violations affecting such institutions. That doesn't mean that we've lost hope. It's not only about this. The individualism requirements have really exceeded the mechanisms of the institutions that function and operate according to an old understanding. So there is no consistency between institutions that operate in an old understanding with individuals who have new requirements. So there is a big disequilibrium, unbalanced, and this is something we need to understand, and that's what I tried to explain from a sociologic perspective, using the term the society of individuals, and individuals as selves, as subjects, as people who hold projects, who have their own perception, the self-concern. This is now something that leads the individuals. And now let me conclude by saying what we want is to establish and develop health educational institutions that are capable of listening, that listen to not to the allies, but to the people that deal with it, the individuals, the clients who have new requirements. There is something in Tunisia that I can share with you, and this is somehow a humor, based on a sense of humor. Do you hear me? Can I share it with you? Okay. Now in Tunisia, there is a term that is frequently used and that didn't used to be used in whatever service. In any interaction, they first say أفرح بيا. Do you understand this expression, أفرح بيا? Do you understand me? أفرح بيا in Tunisian, and the Tunisian dialect means take care of me, give me a special treatment. It is based on farha or happiness. Give me what I want in a personal way, in a personalized way. Give me something that suits me. I don't care about others. This is now very much used in any interaction. What does it show? This shows that individuals now only care about themselves. They are self-centered. They have new requirements. They have new perceptions for everything around them, and that is based on the self-esteem, the self-confidence, self-capacities. And this in my opinion, one last thing, cannot help come up with a social protection system without taking such things into consideration. A holistic approach, the old holistic approach of the last decade in the social protection system is not okay. Having all people all together is not valid anymore. That's it. Thank you. Thank you very much. I'd like to thank all of attendees. I don't think that we'll be able to cover all of the questions, but we have taken into consideration all of your inputs for the research purposes of the project. I'd like to thank the speakers for their generosity, for their very rich ideas. I'd like to draw your attention to the fact that the next webinar will be based on this, to enter into microcosmic aspects, more detailed aspects related to distributions aspects in our region. The webinar will happen again on the 4th of March. This following webinar will take place on the 1st of March, but we will confirm it through the social media platforms. Thank you very much. Have a good day, everyone. Thank you. Thank you.
شكرا دكتور أديب وشكرا دكتورة رانيا. شكرا.
يعطيكم العافية.
باي باي.